The big impetus, I think, was there was a lot of burnout in the clinic, and the nurse that was running the Suboxone program was just feeling completely overwhelmed. And she was asking for more time, more resources, another nurse or other medical assistant to try and help her. And there was no real end in sight in the program. And so that's when I was assigned to help work with the team. Right around that same time, the nurse announced her resignation to leave. And so we're like, oh wow, we have to really rethink everything that we're doing. And we were already down a nurse in the clinic already. And so we knew we weren't going to get the cross coverage from someone else. So that's when we're like, let's rethink everything. We had like 3 big buckets of changes. The first one was clarifying the role between the medical assistant and the nurse. And so that way it was very clear for Jez, all right, these are everything I need to do. And then we also came up with like a whole schedule. So each day there were different tasks. And so that way you walked in and you had a very clear idea of what should I accomplish today. And then the other big part was sort of anything related to like IT. And so that was this Excel spreadsheet. All of the patient information was in the EMR, some was in Excel, some was in a just paper chart. And so we tried to consolidate that as much as possible. And then the other big change was we leveled out patient demand. And so patients before were only coming in on Wednesdays to pick up their prescription, go to group counseling, and see the nurse if they needed to. And then we were able to spread that out to Monday, Wednesday, and Thursday. And so that way it wasn't just this one really, really, really bad day.
Well, Jon brought a lot, I feel like. He brought a lot of knowledge to the team, and like he was just always so helpful and ready to find new ways to make things work. Like I remember once I had I forgot, we had a format and a cheat sheet for like updating the patient list, and I forgot to go through it. And he's like, well, he was really supportive. It's like, if you don't remember it, then it's not you, it's the system. So let's fix the system so that it works for you. And he was just really nice to have, especially after the nurse left. And I didn't really know like my role, and I didn't know how to go about it. He just really helpful with that. So.
For me, I finished my 3rd year of medical school, and so I had a significant amount of patient interaction. But then coming here is more behind the scenes and sort of working vicariously with Jez. And it was interesting. I mean, the first thing I would say is just how patients interacted with Jez. And she's able to have just a great connection with them in a way that I certainly can't. And she's, just like a very bubbly personality and very upbeat whenever we'd work together. And so it was nice because, some days were certainly tough when we'd have a denial, and we'd be frustrated by that. And, patients can get also very frustrated with the Suboxone, and we'd have long wait times and things would not go well. But I felt that Jez always maintained like a very positive attitude on things. And it was just very enjoyable to work together.
There's no wait. They come in, if they have to see the nurse, they see the nurse, they drop off their urine, they go to group, and they leave. There's never any issues about a prescription being on hold because of the PA, which that was the biggest deal. That's what made Wednesdays so hectic, because the pharmacy's calling us like, you need a PA, and the patient's like, well, I need to go, and we're like, but you need to wait like a day or two because we can't get this approved within 24 hours. It was just, all of that's eliminated. It's just a smooth process. Yeah. Wednesdays aren't intimidating anymore.
The patient walks in, they get their prescription, they get to leave. Before they walk in, if it's denied, then they have to go up, wait in the clinic, up to 4 hours sometimes. The nurse is upset because she has to deal with the insurance company. The pharmacy is upset because they have to deal with the insurance company and the nurse. Other patients are upset because now the nurse can't see the other patients that she needs to see for a nurse visit. And so we were able to eliminate all of that.